Welcome to Easy Physiology and Research Pro. This is your go-to NEET-PG and USMLE Neuro high-yield revision. In this short, we're going to simplify the 12 cranial nerves in a way you'll never forget. Cranial nerves are the lifelines of neuroanatomy. Whether you're prepping for NEET-PG, INICET, or USMLE Step 1, this is your must-know zone. We'll break down their mnemonics, nuclei, motor sensory roles, and lesion signs. Fast, focused, clinical. 12 cranial nerves from cranial nerve 1 to cranial nerve 12. Remember the legend. Oh, to touch and feel very good velvet heaven. Know which are sensory, motor, or both. You better. This trick will save you marks and minutes in every exam. Cranial nerves 1 and 2 are supratentorial, from the telencephalon. 3 and 4 arise from the midbrain. Cranial nerve 5 through 7 emerge from the pons, and the rest, cranial nerves 8 to 12, exit from the medulla. This organization makes lesion localization simple and fast. Sensory, motor, mixed? Add in GSA, GVA, GVE, SSA, and SVA. Yes, it sounds crazy, but remember, SSA is special sense like vision and hearing. GVE? Think glands and gut. And trust me, this decoding shows up in every licensing exam. This nerve is all about smell. It bypasses the thalamus and heads straight to the olfactory cortex. So, if your patient has anosmia, think trauma, viral infections, or even neurodegenerative diseases like Parkinson's. Visual processing begins in the retina, crosses at the optic chiasm, and lands at the visual cortex. Any lesion, and you'll be mapping out field defects like a neurologist. Time to master hemianopia patterns. It controls most eye movements, pupil constriction, and accommodation. A lesion? Think ptosis, mydriasis, and that classic down and out eye. This is your most common cranial nerve lesion in diabetic oculomotor palsy. It's the only cranial nerve that exits dorsally and decussates. It supplies the superior oblique. So what? Lesion here causes vertical diplopia and head tilt, often missed, always tested. This powerhouse has 3 branches. V1, V2, and V3. It carries facial sensation and powers mastication. Remember the corneal reflex and trigeminal neuralgia. Both are goldmine topics in NEET and USMLE. Controls the lateral rectus. Lesion here means medial deviation and diplopia. Raised intracranial pressure? Cranial nerve 6 is the first to go. Always check that lateral gaze. Facial expressions, taste from anterior tongue, lacrimation. This nerve does it all. Know the difference between upper and lower motor neuron lesions. In upper motor neuron, the forehead is spared. In Bell's palsy, it's not. Simple. Essential. Split into vestibular and cochlear. Think vertigo, Meniere's disease, and acoustic neuroma. Rinne and Weber tests? Absolute musts in MCQs. These are the auditory lifelines. Taste from posterior third of the tongue, carotid body chemoreception, and parotid secretion. Gag reflex? You're testing cranial nerve 9 for afferent, cranial nerve 10 for efferent. Know it cold. Parasympathetic command center. From voice to swallowing to GI tract motility, this nerve is omnipresent. Uvula deviates to the opposite side of the lesion. That's your exam key. Head turning and shoulder shrugging, via SCM and trapezius. Lesion causes shoulder droop, but watch out for traps. Many confuse this with cervical root injury. You won't. Tongue movement. Simple rule, tongue licks the lesion. LMN? Ipsilateral deviation. UMN? Contralateral. Repeat it till you can say it in your sleep. Quick visual summary. what each nerve does, where lesions hit, and how they manifest. You need to consolidate this table into memory. It is your 30-second goldmine in Viva and MCQs. Cranial nerve 3 lesion equals ptosis and dilated pupil. Ipsilateral face with contralateral body weakness? That's Millard-Gubler. Lost corneal reflex? Check cranial nerves 5 and 7. Vertigo and hearing loss? Cranial nerve 8, every time. Some say money matters, but my brother says big brains matter more. That's your sensory motor map. And remember, nuclei follow the midbrain pons medulla rule. Learn with cases. Revise with mnemonics. Perform like a topper. Subscribe to Easy Physiology and Research Pro.